Good evening. I am here to review with you your clinical evaluation tools for NRN 46. Many of you are doing a great job, and there's some others that are still struggling. So I thought, at the request of other clinical instructors as well, that I would review the process with you so everybody knows that they're on the right track. So what I would love to do is let me share my screen. There we go. And you should be looking at, it says class of 2023 clinical evaluations, which is what Catalina has shared with me. And so I have a list of everybody in the class, and I have asked Ingrid for permission to share her folder. You do not have to have everything set up the way she has it, but she has some great ideas of how to do this. So when I click on her folder or any of your folders, what I will see is a clinical evaluations folder, a portfolio tools folder, and a skills checklist folder. Let's start with the skills checklist. When I click on that folder, Ingrid has actually uploaded each skills checklist, which we have decided you don't have to do, although it is a nice idea to be able to pull them into your e-portfolio. However, you may also just do the PDF of the skills sign-off sheet that shows all the skills that you have completed for the semester. That's fine as well. And you would do this for each semester, well, first and second semester. And then in fourth semester, you will learn blood transfusions and chest tubes. And so you can add that in at that time as well. So if we go back to our main folders, so that's skills checklists. You also can upload your portfolio tools or anything else that you think is important in terms of what you're trying to capture for your clinical achievements. So for example, Ingrid has uploaded, and generally PDFs are the better format to do that in, but she's uploaded the clinical tool verification form, the caring process, the first one, C1 and 2 is there, 3 through 5 is there, the comportment tool, right? So every single tool is listed there. What I think is also nice is that the VNA reflection is there. You could also put anything from Clinica de Salud that you wanted to. There's also examples of the clinical concept maps or worksheets from SVMH. So I think those are great to put in there. Anything we did in long-term care in terms of client problems would also be a good thing to have there. And then the child care center, I think it's great to put that reflection in there because it will show your growth from first semester to second semester when you go again and have a little bit of a different focus. All right, now we come to the clinical evaluations. So let me show you the basic clinical evaluation, the draft, if you will. And most everybody's doing a nice job. What I would like to point out is that this is a record for you to capture those things that you have accomplished during your clinicals throughout the program. They also map to the course end of program, the course end of course outcomes, as well as the end of program outcomes. And so what we've asked you to do is to go ahead and, for example, in comportment. When we say comportment, I think a lot of people think, oh, well, I was on time. And that's all I have to say about that. That's not really true. Excuse me. For example, your delegation comes in there, being prepared, learning how to set up your day, how to care for more than one patient, different things like that, as well as delegation and advocacy when you advocate for a client. And I know that a lot of you have done that in the long-term care, in long-term care with me. And so for the midterm evaluation, what you would have done, right? We're looking at let me show you, this is the end of program when you're in fourth semester, right? You're going to be able to incorporate leadership, management, and legal ethical principles to guide your practice as a nurse. So in first semester, we're asking you to identify and use legal, ethical, leadership, and management principles, right? In learning how to become a professional nurse. This kind of goes back to week 2 when we talked about professional identity. So for midterm, satisfactory, needs improvement, unsatisfactory, not applicable. Many people had some not applicables, satisfactory, needs improvement, that, which is great. So are you prepared? Are you looking to look for new experiences? Are you asking the clinical instructor about that? Are you conferring with the clinical instructor when, for example, there's a vital sign or something that's out of parameter? Are you notifying them in a timely manner? And do you know your own assets? What do you have to offer? And then also hopefully taking care of well-being, self-care for yourself. What it's asking you to do here, see in this part where it says date right there, that's the date that you turn in the comportment tool, which will more than likely be tomorrow. So that would be 12/15/2021. But any place where it says date, you need to have a date there. Okay. And then, for example, if you had a day when you were late or a day that you missed, so that might be a needs improvement. And then for your, if we go down here, that might be comments, right? Your comment is that for whatever reason you were tardy or you missed, which could be a personal reason, which is fine. So that may not be something you'd like to share. But that your goal is that for the second half of the semester, you're on time and prepared for everything. And so then you're going to go back and say, oh, yes, I did that. That was great. And then as you continue through, now that was the first 2. Now we're looking at advocacy, right? So using nursing interventions that represent or support client advocacy. So speaking up for clients' rights and needs, which I know we've done. We just had an example in long-term care where we were advocating for a client who really had a stage 2 pressure injury on the upper part of her foot. And it has taken us weeks to get somebody to actually realize what we were talking about. And so that would actually be a perfect example to put under your required comments there as an example of advocacy. Could be in the hospital, could have been at Clinica de Salud, could be VNA, wherever it is, that would be a great example for advocacy. The next thing you want to do is see clinical portfolio carrying tool as evidence. So everybody has completed that, right? That was due last week. And so what you could do is you want to put, again, the date that you turned that in, right? And you're going to check that off as satisfactory. And because you did the second one in this column here, you're going to also check that off as satisfactory because this is the end of the term, right? So you're going to do end of term evaluations now, right? So we're in the end of semester evaluation, right? All right, moving on to legal ethical. This one I think is sometimes a little more difficult because we don't always run into legal ethical issues, although there is always potential for those. And so when we look at legal ethical, were there any issues that came up, any mandated reporting? Was there a problem with confidentiality? Did you remember to log out of your computer, when you were charting? Are you practicing according to the Nurse Practice Act, the Code of Ethics? And are you expressing truthfulness and humility in all of your professional actions? So if you make a mistake or you think something's not quite right, are you coming to the clinical instructor or the nursing staff and saying, hey, this is what happened and I really could use some help with this, right? So that's a good thing. Here also is your interprofessional collaboration and communication tool. So again, you had one due at midterm, then you had the other 2 interactions due by last week. So include the dates that you turned those in. So it would be 2 dates listed there. And if you did advocate for a legal ethical situation, you can put it there. For this one, you could put not applicable. And you could also write in here, if you didn't advocate for that type of situation, opportunity not available, something like that. If you did, then you would give an example or say, see notes. And guess what? That's where you put it under the required reflection part there. All right. And then for leadership management, right, beginning to use leadership management skills. So are you offering and seeking assistance? I've seen a lot of that. Everybody's so helpful in long-term care. I really appreciate all that. Is there a need for time management? You have to really think about how you're you're putting your day together and what you need to do, especially in the hospital, and especially as we move into future semesters where you're going to be taking care of multiple patients in maternal newborn health. Next semester, you'll have a mother and baby. You'll have 2 patients that you're caring for. And so you're going to write in, yes, satisfactory, you've learned how to do that. Many of you have been working on being able to identify tasks that you can delegate, perhaps to a CNA or another team member, and begin to take a leadership role in the profession. So I think everybody, just by being on the floor and advocating for your clients, I believe you are taking a leadership role, and you're also reflecting on your actions and thoughts and patterns and all those types of things. And that is how you begin to take a leadership role and take accountability and responsibility for your own actions. So if you attended or participated in a professional organizational meeting, could be SNA, could be A1, could be the critical care, could be something out in the community that you've done. I suppose you could potentially put the faculty curriculum eval meetings, the faculty meetings if you wanted to, but again, you want to put the date. And then your delegation tool, the leadership and management delegation tool, where you follow the CNA or the PTA or some other member of the healthcare team. So hopefully you learn some things that can be delegated. You watch that process, you watch the difference between what a nurse does and what that other healthcare team member does. So again, when you turn that in, you want to put that date there. So I've given you some examples of what you would put in the reflection piece. Remember, I told you back in week 1, there's going to be a lot of reflection, and there is. So your reflections go there. Hopefully you have a reflection for each piece, especially the hospital, long-term care. I think there was a lot of learning, and you could potentially put for the community, you could have some words about or some thoughts about your community experience in SIM and VNA and Clínica de Salud. And a lot of students, I thought, did a nice job of bringing the VNA into your community papers. That was really nice to read about that and how you think VNA is interacting with the community. So that was really nice. So goals, remember, we want to set goals, right? We always have a personal growth goal. Every day we go to clinical, right? So every day, what do we want to accomplish? And then did we accomplish them? Did we not accomplish them? For the end of semester, you want to think about what goals you have for next semester. Is it taking on more patients? Is it, coming up with like a brain tool? Is it, I don't even know what it would be. Is it performing a particular skill? Is it getting better at SBAR? Those types of things. And then faculty would put their feedback here. And hopefully faculty are doing that. Some faculty are doing, a few sentences, some are doing some paragraphs. It really kind of depends on the faculty member. All right, so hopefully that makes sense. Let me show you the student example. And again, thank you to Ingrid. So this would be the mid-semester, right? And so I don't think there was, I don't know if there was extra evaluation or not, but yeah, needs improvement. We all need improvement for that. Now look at the end of semester, right? So there's midterm and now there's end of semester, right? And so then there's the date for the comportment tool. So she turned that in early or had somebody check. That was at the beginning of the semester. The first caring tool was done. Any legal, ethical, behaviors, those types of things. What I really appreciate is that the time that the student took, any student that has taken the time to really think about what it was like to be in the hospital, to be in long-term care, would not find long-term care as challenging. So thank you, appreciate that. Not why I put that up there, but oh yes, Jenga, many games of Jenga, which one would think, Jenga, who cares about playing a game? For this particular client, oh my goodness. I actually played today Jenga with the client and the students, and it lifts his spirit so much. It's just absolutely amazing. And then here's goals that you set for yourself. There's some faculty feedback. I put mine in pink, generally speaking. And so that is an example for comportment. Now I'll move on to competence. Competence, that would have to do with the skills, but there are some other things as well. So we're talking about clinical judgment. It's not just about the doing, but the thinking and reflecting on it. And I think students have difficulty with that, especially in the first semester, because you want to do and learn things and do things, which is great. But you also have to think about why you're doing something, what you need to do. Why did I do this and it didn't work? Was I thinking something differently? What, those types of things. So for example, we're looking at you as the student beginning to use clinical judgment, right? And looking at those, I talk about foundations and fundamentals all the time with you, right? Building that foundation and then building upon that as you move forward in the program. So we're asking you to any care plan, concept map, anything like that from clinical, you could put the multiple dates that you turned it in. That would be amazing. And then at the beginner novice level, we're going through Tanner's clinical judgment model. So basically, were you able to notice, right, a thorough assessment using a systematic approach? Like, did you do a head to toe, and then maybe you did a focused assessment based on what you found on the head to toe assessment? And then any client problems, we don't really call them nursing diagnoses anymore, so I will update that, but any client problems, right? You looked at this assessment data, you're interpreting it, you're thinking, is there, thank you, Sparkle, is there a pattern? Does the client have a problem, right? So what data are you using for that? And then can you cluster that data? Does it mean that there's a problem? Does this relate to this? And looking at that. And then can you develop a plan of care? So that's interpreting and responding, and that would be setting the goals for your client. So using the foundational concepts, looking at the patho, looking at the medications, doing a basic plan of care, taking into account the individual client characteristics. So maybe the goal is that, actually for that same client, the goal was that the client would not order DoorDash for a week. And that actually happened, not for the reasons that we were hoping that it would happen, but it did happen. Or we want the client to ambulate. We want the client to take the medications as scheduled, whatever it is, perform their range of motion exercises, something like that. And then you implement it. How are you going to implement it? Are you able to do that? And then the reflecting, right? The evaluation piece, going back and say, well, did they accomplish what we set together? Because remember, you're setting goals together with your client, hopefully. Did that work? And then if it didn't work, okay, then what do we have to do to revise that? If the client didn't, wasn't able to do the range of motion exercises, why not? Are they non-compliant? Do they really not know how to do them? Was there no time? Did they have a lot of pain, right? You're looking at those different aspects so that then maybe we medicate before we do that, those types of things. And so again, you're going to use those same dates that you use for your care plan. Where do we put it? Up here, it's the same thing, right? So you just add the dates again there. It just is speaking to a different goal, different outcome. And so then were you able to formulate an individualized, a personalized plan of care for your client, right? And hopefully looking at some related concepts. So it could be a psychosocial, it could be stress, it could be mobility, elimination, all of those types of things. And then can you modify it according to the individual client needs? So these might all have been needs improvement earlier in the semester, but hopefully by now you're at satisfactory. You can at least, back to the ones I've seen, you all are able to do this quite well. And then your own assessment findings, any measurable goals, nursing interventions, and then is there any potential for injury, fall risks, right? We did the fall risk tools, we did Braden scales for the wounds, and then are you able to explain what the next step is if the goals are met? Like, do we set new goals? Does the client go home? What are we looking at? Or if the goals are not achieved, then how do you go back and work with the client, right, to do that? And so you're also looking at your, now you're going to be looking at your clinical worksheet, right? It could be whichever, area where you were, and looking at safe environments, reducing risks. And so are you able, in your worksheet, you have this, like, you have the history, you have vitals, you have an assessment, you have the medications. And so are you able to observe? Are you noticing the data? What does it mean? Are there any abnormals? Are you reporting urgent things to your clinical instructor and the nurse? Are you performing those safety checks, that 60-second scan of the room and scan of the patient when you first come onto the shift? We talked in clinical today actually about ambiguity, like what's acceptable versus what's not acceptable, because it may tell you one parameter in the textbook, but your actual client may have a slightly different parameter. So at what point does it become concerning? So I think that's a great learning strategy, like what would be of most concern to you for your client where you would have to intervene. And again, care plan concept map. Or was there anything, skin breakdown? Are they at risk for falls for whatever reasons? Are you identifying that? Because there's a safety section on the worksheet, right? And so that's where you would put that information. And then you're performing any fundamental nursing interventions or psychomotor skills. So it's actually doing the skill. Is it, do we check our orders, right? Are we able to give the medication? Are we able to do the treatments? What are we supposed to do? Are we employing the basic rights of medication administration? And we're performing things safely. So we had an opportunity in long-term care to administer flu vaccine, second COVID, I think, or COVID booster, I think it was. And so students had an opportunity to do intramuscular injections. So that would be perfect. Medication administration. We had opportunities for some wound care. Those are all good examples. So when you go back and look at a completed clinical evaluation tool, that's basically what you're doing is, am I satisfactory? Did I need improvement? Okay, now I feel like I can do this. I have a basic understanding of how to do this. Because remember, we're at the basic level. We're at the fundamental health promotion, perhaps chronic illness stage. We're not in ICU yet, okay? And so, there's the dates are listed there. The boxes are checked in. And then again, there's a summary from long-term care and from the hospital. And then a goal, which I think is great, right? To continue to feed my curiosity so that when you have opportunities, right? Look for opportunities. And then there's some faculty feedback there. And then the next one will be caring. So now we'll go through caring. Caring is the shortest one, which is one of the reasons I like that. I like that one. It's okay, girl. Sparkle's enjoying hanging out with us. So integrate caring into relationships and nursing interventions that demonstrate sensitivity to the values of others. So that's why in your caring tool, we're asking you to look at all these different caring behaviors and how they affect us and how they affect our client. And so, assess their developmental stage and then look at, can you figure out what are their values or their culture or their, age or their whatever it is that's going to help you provide individualized care and caring. And so you're looking at your collaboration tool, right? Because the communication tool, because that was 2 examples of a conversation with a client as well as one with a healthcare provider or member of the healthcare team. And so that's why we ask you to specifically put what you said and hopefully what they said, your client said, or the healthcare provider said in quotations, direct quotations, so that we can really see what our communication looks like and how do we know that it's effective or ineffective. And so we're looking at, which you did also see how this crosses over with 47, looking at cultural and spiritual preferences, adaptations for interventions based on family preferences, those types of things. And so then you've got the dates for your communication tool. And again, your concept map or care plan, right? So how your communication style was adapted. And that's why that question was on your final exam, because it ties back into clinical and the caring and will help you move forward. If you can identify what's effective and ineffective in how to individualize care. All right, and then compassionate care. So the caring tool as evidence, right? Cites your behaviors. Next semester, when you do your caring tool, you will be able to choose from the 5 caring behaviors, one that you experience in clinical, and then come back to first semester and look at what did you say that you needed to learn more about? And so did you actually do that? And how have you grown in that particular caring behavior? And so then you have your reflection and any goals and faculty feedback. So let's look again at the student example for caring. Again, things are checked off, the dates are written there. There should probably be 2 dates because you'd want the date for 3, 4, and 5. And then again, reflection, which is great, and goal. And then there's some more faculty feedback. All right, and then we move on. Let me move that back up. There we go. Okay, now we're going to move on to collaboration. Lots of that, lots of collaborating. So again, communicate and collaborate with members of the interprofessional healthcare team in many different settings, out in the community, in the hospital, long-term care. You know, when you do your community projects, educational things, that's collaboration and communication. So everybody should have included in the clinical site orientation that happened for everybody, and then dates for your collaboration and communication tool. And also, hopefully there was either a worksheet, or I know in long-term care, we worked a couple times in pre or post conference on SBAR. So you could use that as your example. And then begin to establish therapeutic relationships with clients. Long-term care is all, that's what all long-term care is all about. So hopefully you were able to do that in the other settings, but I do think it's rather difficult to do that. However, when you have your communication tools, you are looking at therapeutic communication. Were you able to communicate therapeutically, which, remember, therapeutic communication has a goal and a purpose. Were you able to do that with the healthcare team member or the client, right? And hopefully you grew with that and learned some things. And then there's your communication collaboration tool, date again. So we also asked you, was it effective or ineffective? That's on the communication tool. And then any therapeutic professional communication methods and strategies to show how communication was adapted to a client's unique characteristics. So that could be cultural, it could be age, it could be spiritual. I kind of feel like, especially when you're talking to a healthcare provider, like a physician or somebody that you might tend to think is above you, but remember, we're all equal. We're all on the same playing field. But I know some students have relayed that, you know, the characteristic of the physician, for example, they were pretty like, you know, I'm the physician. And so that was how they had to adapt their communication. They really had to think about, gosh, I need to get my notes together and I need to kind of come off, exude confidence, even though I'm not very confident right now. And that's how you adapted your communication. And I think that's an acceptable answer. And then in terms of your health promotion teaching, we do that. That's like all we do is education about all kinds of things. And how many times do we have to repeat it, like over and over and over again, right? So we want to assess the client's learning needs. What do they need to learn about? Are they ready to learn, right? What are their learning preferences? Do they like visual aids? Do they like to, you know, handouts to read? Or are there barriers? You know, do they not read very well? Do we need to do the handouts in Spanish? Are they just so depressed that there's no way we're going to be able to help educate them or get them to change their behaviors because they're so depressed? We have to deal with that first. And then, is the health teaching appropriate to their age, culture, and all that? Because we've assessed it and now we've come up with a plan to implement. And so you may or may not have done your methods teaching plan. You can, hopefully you did that at SVMH. I think everybody did that at SVMH. We did some early on in long-term care, but you put the date there, and then, and that would be your educational plan. What did you identify were things that the client needed to learn? It may not have been everything in methods, the METHODS. It might have just been medications and safety, something like that, or procedures or something. And that's fine. Whatever is for your client applies to your client. And then professional communication. So reporting significant changes to your instructor or the staff in anything, which is great. And then again, your collaboration and communication tool. This is the one with the healthcare provider. Was it effective? Any lessons learned or any potential legal ethical consequences? May or may not be. But I like it when, I love it when the students, when you're talking about what the communication was, and then really giving examples of was it effective or not, and the impact that that has on the client, on their care that's provided. And so if there's anything specific like open-ended questions or, you know, direct things, or closed loop communication or repeating back so that everybody understands. And then potential clinical post-conference topics as evidence. Hopefully we talked about any conflict. I know in long-term care, we had a couple issues with conflict. And then was there resolution? How did that happen? What happened? Was there finding intersection? We talked in long-term care today about the cycle of waste, and everybody went, whoa, because that was like 15 weeks ago, right? But it comes back. So the cycle of waste, the finding intersection, how can I connect with the person who just left a note telling me they wanted me to leave the nurse's station, right? I had to find something, where can we intersect? Where can we find purpose, find something that we both share, right? And work from there. Or if that didn't happen, can you think about another, maybe the opportunity didn't present itself. So what would you look for? What would you have done? What could you have done? And then your comportment, again, as looking at the roles of the different team members, right? So remember the dates, where it says dates, put the dates. And then, SBAR communication, student to student, if you guys practiced with that, or shift report, or if you actually had to call a physician or another healthcare provider, somebody to do some kind of handoff report. You're blocking my way, Spark, I know. And then your reflections on that and any goals or faculty feedback. So let's look at our student example. Again, the dates are there. The boxes are checked. So this was showing some needs improvement, or the student felt maybe they needed some more practice. And so that one probably needs to have a check mark there, but things have improved. The student feels like they can participate now. And then the same with knowing that your communication was effective or not. How do we determine that it was effective? There are different ways to do that based on maybe the care plan that we put together, or if the person can teach back to us or restate to us, or if there was an example I read today about doing a dressing change, right? And so the student wanted to make sure that they were performing it correctly with the physician. And so, we want to make sure that that happens. And so the confidence was built because we got to do it. We got to do that again. All right, working with the team, right? So that's all there. And then again, a reflection, and really thinking about, what is it about me? What can I bring to the table? What assets do I bring? What are my strengths? And then being able to identify areas for improvement. And so goals again, and then faculty feedback. And then we'll move on to curiosity. All right, this is the last one. Hang in there, guys. You're doing great. Hopefully you can fast forward to the ones that you have questions about. So curiosity, right? Maintaining, modeling a spirit of inquiry. And so what we're going to do first semester is kind of relate it to looking at data, challenging the status quo, and questioning underlying assumptions. So I think our spirit of curiosity in terms of our client in long-term care with the pressure injury on her foot, we looked at the data and we looked at the client, and there's no charting and there's no documentation, there's no order. What is the data? There's this, what looks to be a stage 2 injury. And so we had to challenge, not me, well, I mean, I helped, but the students really, you guys really pushed it forward and kept asking the nurses and kept following up, and we provided opportunities for improvement, and it didn't necessarily happen. And so then I eventually went to one of the directors, and it got taken care of right away, which was really nice. Sad that had to happen, but it got taken care of. And so we talk about a lot of assumptions that the staff maybe have, right? And we can't always, so-and-so will take care of it. Oh, I'm too busy on day shift, night shift will take care of it. No, it's up to you. If you're the one that's identifying it, then you are the one that needs to fix it and move it forward at least, and fix it and follow up on it. Okay, so informatics and technology. So navigating the electronic health record, being able to enter data into the record, using the different technologies, EMR, the glucometers, we learned about glucometers, and then creating your e-portfolio, which everybody has turned in, and they look great, I will say. My apologies for not for you guys to keep getting messages that we weren't able to open them. So I apologize for that. But they look amazing. So you guys put a lot of work in it and it shows. And so just keep updating and updating and go back between this clinical evaluation tool and your ePortfolio. They should work together. Okay, so evidence-based practice, right? Ms. Clark talked a lot about that. You know, that was one of her lectures. And so, you know, putting together an individualized nursing plan of care, focusing on one need and maybe 3 interrelated concepts. So I think everybody's able to do that at this point, including your own relevant data that you found, your goals, your nursing interventions, right? Because you remember, you are the nurse, right? You all are the nurse. When we say nurse, you know, nursing, the nurse interacts with the community, it's you interacting with the community, the nurse interacting with the patient, it's you interacting with the patient or the healthcare team. You know, being able to identify injury or harm, and then explain what can happen. So again, your concept map care plan date goes there. And we kind of did this in another place up above. So you've already accomplished it, but it's ticking off another goal that we have for you in our outcomes and thinking about your clinical judgment. Okay, healthcare quality related to the national patient safety goals. So remember, we went over those. I believe Mr. Molina had that particular topic. And we've talked about them in clinicals as well. And so what relates to acute care, what relates to home care, what relates to long-term care? Are they the same? Are they different? If they're the same, or if they're different, are they really the same? Are we looking at focusing on different things? So always using your 2 patient identifiers, right? Even if they don't have a band on in long-term care, right? We have to have 2 patient identifiers. Always doing your hand hygiene in and out of the room. And then, you know, being compliant in all your clinical settings, because sometimes like home care, the client doesn't have a soap dispenser by their front door, right? So you have to have supplies. You have to think ahead of what you're going to need. And then any near misses, identifying, you know, med errors, near misses, doesn't have to be a med error, it could be another type of error. And how would you take corrective action? So it could be something that happened in clinical, it could be an example used in post-conference. And so then again, you're going to do your required reflection, set any goals, faculty feedback. Let's look again at our student example. And so again, the boxes are checked, the dates are there. You know, things that needed improvement are now satisfactory. And then, you know, knowing your strengths and areas for improvement. And then there's goals, and then some feedback. And then there we go. And then the signature page. So for example, this was signed, I signed that, Ms. Dominguez signed that, the student, you know, is there. And that would be their clinical evaluation tool. And so there's your signatures. And then if there was an improvement plan, additional evaluation needed, then your clinical instructor would have spoken with you about that and you would know about that. And so hopefully those are all resolved by now, since tomorrow is the last day of clinical. So that is all I have to say about clinical evaluation tools. This will be posted in an announcement. And so if students have questions about their clinical eval tools, they can either contact the instructors directly, or you can post a comment in the announcement. Okay, so I look forward to looking through these and providing feedback for you, and I hope you found it helpful. All right, have a good night, get some rest, and have fun in clinical tomorrow. Let's see, stop sharing.